Well, good evening, everybody. It's my pleasure to welcome you to our Family History More Than a Story webinar for August. My name is Dr Naomi Parry, and I'm Dr Parry Duncan, and I'm a lecturer in family history at the University of Tasmania. And I'm very pleased to be able to welcome our guests tonight, Dr Cate O'Neill and Dr Frank Golding. Before I start, I would like to offer an acknowledgement of country, and to say that today we're meeting across Lutruwita, Tasmania, Aboriginal land, sea and waterways online. We acknowledge with deep respect the traditional owners of this land, the Palawa people. The Palawa people belong to the oldest continuing culture in the world. They cared and protected country for thousands of years. They knew this land, they lived on the land, and they died on these lands. We honour them. We pay our respects to elders past and present, and to the many Aboriginal people that did not make elder status, and to the Tasmanian Aboriginal community that continues to care for country. I come to you from Darug-and-Gundungurra country in the Blue Mountains west of Sydney, where we've had a snowy day, and I would like to pay my respects to elders across Australia who are in this room with us tonight, and to any Aboriginal people who are present in the webinar. So to get started on the webinar, I guess a couple of little housekeeping things, which is that first of all, you will all be muted. If you want to put questions in the chat, there is a Q&A section for questions, and there is a chat section for chatting to people as you come in. And what we often find in these seminars is people like to acknowledge the countries they've come from, they like to chat to each other, and that goes on in the chat. And then in the Q&A, if you have a formal question in the Q&A, then pop it in there and I will come to it as we go on. So we'll have our speakers first, and then we will for about 40 minutes, and then there'll be about 20 minutes for discussion following on from that. So to introduce the topic tonight, we're talking about family history and care leavers, as in people who grew up in institutional care and former child migrants in Australia and elsewhere. And our speakers are two incredibly qualified people on this subject. Dr Frank Golding Oam is an honorary research fellow at Federation University Australia, where he completed a PhD entitled Care Leavers Recovering Voice and Agency Through Counter-Narrative. He is a life member of CLAN, the National Care Leaver Advocacy Body. He himself is a former ward of the state of Victoria and is now a social historian, and has contributed to formal inquiries and national projects dealing with the institutionalization of children, and presented papers on child welfare in the UK, Ireland, Sweden, Italy and Spain. He has written book chapters and refereed journal articles and more than a dozen books, including a memoir, An Orphan's Escape, Memories of a Lost Childhood. He has just completed a study of a remarkable welfare family that extends over 5 generations. And Frank is an absolute national treasure in my view. So it's really fantastic to have him here tonight. And Dr Cate O'Neill is the National Editor and Research Coordinator of the Find and Connect web resource in the Faculty of Arts at the University of Melbourne. With an educational background in historical studies, Cate has also worked in archives, including at the Public Record Office Victoria, where in 2005 to 6 she was involved in a project aimed at improving access to records of the stolen generations, as in Indigenous children removed from their families and communities. Since 2008, Cate has worked on projects at the University of Melbourne, engaging with the history of children's institutions in Australia, in collaboration with a diverse range of stakeholders, including care leaver advocates, past providers of institutional care, policy developers and academics from a range of disciplines. And it was my great pleasure to work with Cate for 3 years on the Find and Connect National Web Resource Project. So we go a fair way back, and that's how I know Frank as well. So welcome to tonight's discussion. It will be fun. So firstly, I guess I would like to ask, well, I'll start with Frank, if you wouldn't mind introducing or talking in a bit more detail about your work and about the sorts of areas that you consider to be very important, that touch on family history that relate to you. So if you wouldn't mind, Frank.
Well, thank you, Naomi. You can hear me all right?
Yes, very
Yeah.
well, thanks.
The first thing to say about myself is that I was in out-of-home care for 3,983 days and nights from the age of 2 to 15 in 3 foster homes and 3 institutions for children. And can you imagine what it's like living in an orphanage with 200 other grieving children when you know you have parents? I spent the next 20 years or 70 years trying to understand why I had that sort of childhood. I always felt a bit of a goose when my own children asked me about my childhood and I couldn't give them a satisfactory answer because I simply didn't know. No one in all those years as a child ever told me why I was not able to live with my parents. And when my brothers and I was 15, my brother Bob was 16, Bill nearly 17, no, nearly 18. Our mum and dad refused to discuss the past. They were adamant that was all history. They hadn't read James Baldwin, who asserts correctly that we're all trapped in history. It frames our critical points of reference and we can't just ignore it. It's always with us. So the catalyst for my becoming an activist came with the introduction of FOI legislation that enabled people to get access to personal information in government archives. And the process and the outcomes opened a can of giant worms for me, which we can talk about later. The many problems in that process of accessing the archives led me and a number of other care leavers to see the need for advocacy and activism with access to records, but leading also to other important causes. In Victoria in 1996, I was the founding secretary of a care leaver action group called Innovate, and then we changed it to 4 wards, and then LOSS, Lives of State Shame. We were all volunteers and struggled because we lacked the resources. Apart from a rickety second-hand table donated by the minister at the time, one Dennis Napthine, our only funding came from a large legal firm in Melbourne, which had a vested interest in providing contacts for a number of care leavers who were mounting a class action relating to abuse in out-of-home care. So when Leonie Sheedy and Joanna Penglaze set up the National Care Leaver Network, CLAN, in the year 2000, I was quick to get on board. And I must say, the model has never wavered. An advocacy and support network established by care leavers, for care leavers, and to be run by care leavers. And as you know, over the years, CLAN has asserted itself as a truly national force, providing support for care leavers in matters such as access to records, support for services in health, counselling, community awareness, sharing information, redress for abuse in out-of-home care. And funding's been secured now for trained professional staff that we employ. But the Committee of Management of CLAN has always remained dominated by care leavers. And it's not too far-fetched to claim that CLAN was instrumental in getting the Senate committee to examine historical out-of-home care and to produce its seminal Forgotten Australians report in 2004, which led ultimately to the Find and Connect service, the Oral History Project through the National Library, the travelling exhibition sponsored by the National Museum, a number of public apologies, and further inquiries culminating in the Royal Commission on institutional responses to child sexual abuse in 2013 to 2017. CLAN does a power of work to support care leavers accessing their records, both at the policy level and hands-on casework with individuals. My involvement continues as an activist a life member of CLAN. As a scholar of sorts, I completed a PhD during the COVID lockdown. What else can you do? As you mentioned, I made the case in that thesis that care leaver history is not just another branch of family history. And I think we're going to talk about that more lately.
Oh,
what about you, Kate?
Thanks so much, Frank. Just want to acknowledge that Leonie Sheedy has just joined the webinar. She said that
good.
in Perth. She's walking the streets of Perth, walking back to her hotel. So
it's early
hello,
afternoon
Leonie.
for her.
It's so nice to have you here. Leonie is, you know, another national treasure powerhouse. And yes, I mean, all that, I don't think it's arguable that the work that you did, you know, created the impetus for all of those things. It wasn't accidental. It was because of a lot of hard lobbying and a lot of hard work, and very painful work. So yeah, thank you. And Kate, what do you reckon?
Hi everybody, I'm joining you here from Wurundjeri land tonight. Yeah, what a hard act to follow Frank is. I am a historian. I don't have a lived experience of care. I feel very privileged to have worked in this area on and off since, around 2005, and to benefit just from the lived experience of these amazing people who survived a childhood in out-of-home care and are working today to raise awareness to the ongoing battle for justice. I should probably come clean and say I'm not a family historian, unlike probably everybody here. I've got very little skills in family history, but I do talk about family history a lot, and in my role working on the Find and Connect website, which is, if people aren't aware of it, it's been funded by the federal government since 2011. It was one of the more concrete outcomes that the government delivered after the apology in 2009 given by Kevin Rudd. So we are a website that records the history of every children's institution that's existed in Australia going right back to 1788. Even though there are still homes that we are finding now in 2022. So we have history about these homes. We also try to have information about what records have survived, and we want to help people who are interested in knowing their history to get access to those records. So we also have an advocacy role as well as an information service role. So we don't hold records at Find and Connect. We're like a giant finding aid. And the historical context that you'll find on the Find and Connect website can be a really useful tool for people doing their family history if they've had family members who were in institutions in the past. And institutions could be orphanages, children's homes, reformatories, maternity homes, babies' homes. The information about these homes and about the actual systems that existed around Australia in child welfare. This information can provide a scaffold for people to build their own personal narratives and their family history narratives around, to give an explanation as to that. Why were people taken away from their families? Why did the government think this was a good idea? Why is it still happening today? What's changed? What hasn't changed? Yeah, so that's probably enough of an introduction from me.
Yeah, I think that's a great, you know, yes, I think they are a family history resource. And I suppose I want to kind of talk with the caveat that that the way that those records work is that they belong to the institutions that created them, not to the people that were named within them. And I know we will talk about this a little bit more, but yes, I always, I was asked a question this week about somebody wanting records of their mother, and it's like, you would think, well, it's a record of your mother, so therefore it would belong to you, but it doesn't. And so this is an issue that I'm sure that Frank has had to address. So Frank, do you want to explain some of your the family history that you have discovered and the way that you've used those intergenerational stories in your work?
Yeah, I mean, it's a very peculiar history that I bring to this as a child. Unlike most of the people who are in the audience tonight, I imagine, I didn't come home from school every day as someone's son or daughter, brother or sister, or someone's grandchild. I had no private life except in my head, and I owned very few personal possessions. So the culture of institutional regimentation provided a stable frame of reference, but it was destabilized by an underlying apprehension about the circumstances of my being locked up in an orphanage as a child. Why was I there? How and when would it end? Or at the time, if it would end. So I had to wait until I was in my 60s to learn from the historical files that when I was a 2-year-old child, I was charged with the offence of being a neglected child, and I was committed as a ward of the state. I then found in my records that I was discharged on probation at one stage and then recommitted before all those years later being discharged into the custody of my parents. And that's what led me to write the memoir, An Orphan's Escape, Memories of a Lost Childhood, in 2005. There was enough in the files to tell me to look outside, though, to use police archives, for example, contemporary newspapers and court records and military records to construct some sort of narrative that made sense. I was actually struck by the number of people who contacted me after I wrote that book with snippets of information. Some of those were close family members I'd never met, first cousins, even nieces, daughters of a sister I never suspected I had. And I drew on that knowledge through those connections, meeting them face to face or through social media, through swapping genealogical websites which link their family trees with mine, DNA, as I mentioned. And then there were other sources of information that I gained through. I had to go to the county court to appeal a decision that the department gave me that I couldn't have adoption records. And then I had to also to go to the Supreme Court of Victoria to have access to divorce affidavits, which explained a lot of the story. So I've actually painstakingly reconstructed what turns out to be an extraordinary family on my mother's side of the family. And in that process, I've identified 33 of my relatives on that side of the family who were out of home care in Victoria. 5 generations, 16 different institutions. And it all began in 1864 when my mother's grandfather, Edward Sinnott, was 11 years of age and sent to an industrial school at the request of his stepfather, who told a magistrate that little Edward was uncontrollable. I'd like to talk a bit more about them later on, because it goes to that whole history of resources and how you find out these things. But what that research is effectively done is to make me relocate my childhood into the context of the intergenerational self, that extended institutional life, which is embedded in the social history and of state intervention in families. Now, if you think my family was an aberration, let me tell you, when Clan surveyed more than 500 care leavers back in 2010, there were 520, I think, respondents. Over 40% of them told us that they were not the first of their family in care. 137 of them had a parent or grandparent in care, and a further 75 told us that their children or grandchildren had been in care, and the cycle's been repeated with the next generation. And we got comments like, my grandmother was put in the same unmarried mother's home that my mum was put in when pregnant with me. And I became a state ward at the age of 7. I'm the 3rd generation in care. I reared the 4th. So there's a significant amount of information, not coming from departmental sources, I hasten to add, but coming from this kind of family history research that says there's a significant number of people who are caught up in that, on the welfare treadmill over several generations. And you know, without going too far into the details, it must be said the system didn't help. They separated children from their families and made sure that the parents were not able to be in easy contact with them. In the research I've done, there was a review of the system, Victorian system in the 1960s, and more than half the applicants that parents made wanting their state children returned to them were rejected. And the reason they gave basically was that the parents were, quote, unfit or inadequate persons. And so there was a kind of systemic imperative to keep the parents and the children separated once the state got control of them. And then the siblings were separated also by age and gender within these large barrack-like facilities, even assigned to separate institutions in many cases. Again, in that same survey in Victoria in the 1960s, separation of siblings occurred in 66% of cases. Sometimes the siblings were sent to different parts of the state, making it very hard for parents to actually travel to have contact with and visit their children. And many of the siblings didn't see each other after that.
The system was really designed for people to not gain that sense of a narrative inheritance and the things that a lot of people take for granted about how they know who they are, which is through your connection to other people and those informal things that happen when you come home from school and those conversations. And yeah, the system. One thing that struck me, what you were talking about, Frank, the language that was on your files about being charged when you were 2 years old, it was a very carceral system. It's very much about control and confining people. And my colleague Kirsten told me a great word today that she came across, trans-institutionalization, which is used by a woman called Susan Birch in a book she published last year about an asylum in the US that was for Native American people. And that idea of like trans-institutional, like being bounced from different institution to institution, just this involuntary confinement that just keeps happening, and it happens intergenerationally too.
Yeah. I can think of one case where I've seen the records where one of the files has an officer of the department congratulating himself, being very smart, because he told the parents that the children were in different institutions. He didn't let them know that in fact they were all in the one institution, and he made in the course of that made some quite racist remarks about that particular father who was trying to gain control over the situation by having all the children in contact with him. There was quite a deliberate ploy on his part, and he thought he was being clever.
Yeah, I think there's a lot in there about attitudes to families and to particular sorts of families and working class families that, and you know, often it came out of poverty. People were in a hard situation because of poverty, but the poverty was judged in particular kinds of ways, and so there was a definite all those sort of old ideas about rescuing children took from dissolute or immoderate parents. It took a really long time for them to wear off, and I don't think they have yet. You know, it's this sort of, we've just had in New South Wales, you know, the Prue Goward as minister is putting in ways to permanently remove children from their families within, you know, as little as 6 months, kind of, you know, that the family only gets 6 months to get on track, and their babies are forcibly adopted. So there's, you know, it still is going on, and there's a lot of comments coming through in the chat about that, about how sibling separation occurred in the UK childcare institutions. And in Australia, there's a lot of influence from the UK naturally, because of cultural connections. And Leonie pointed out that she is weaning herself and clan from using the word in care, because they were put in the hands of strangers and in danger, which is very much the case.
Sure.
Yeah. Do you want to talk a little bit about the nature of those records and about that sort of the kinds of language that people find in those records? Because when we're talking about piecing together family histories. It's a risky project, isn't it, Frank, in terms of what you will read and see and find in those records?
Yeah. Look, Kate might want to say something about this because she's been chasing down those records. But as far as the individuals and families are concerned, there are plenty of examples of flawed records which are overwhelmingly negative. They focus on the children as problems. They talk about the defects of the children or their families or their parents, and the way they felt free to write derogatory and insulting language about parents and the children. But also it's worth remembering that, and certainly my case, when I asked for my records in the early 1990s, the archival system itself was deeply flawed. The children were moved around within the system, but so each institution or agency had its own set of records, and they didn't necessarily correlate. And so in the early days, I had to go to half a dozen different places to find my file. I expected to find a file that would cover all my history, but in fact that wasn't true. So I had to go to different agencies, and some of those agencies were cooperative and others were not. Some said, we're not under FOI, so bugger off. You know, we have no obligation to provide you with access to those records. And then, of course, there were the awful redactions. You know, I couldn't read stuff that related to my parents or my brothers because that was a breach of their privacy, all that in quote marks, a breach of their privacy. I mean, what is a family if it's not siblings and parents? So anytime my father was mentioned, he was quite a character and very influential in my childhood history. His privacy was to be protected, and I had no rights in the matter. So we had long battles fighting that kind of mindless redaction. But quite often the redactions were even more stupid. For example, in my file, I found that a letter, the only letter my mother actually wrote. My father was the main letter writer, but the only letter my mother wrote had a paragraph redacted, and under successive appeals, I finally won back the right to see that letter, and it talked about my brother working on a farm, being sent to a farm in the Western District of Victoria, and not being paid. Well, we knew all that. There was no surprise there. In fact, the surprise was that it was so disappointing. I thought there was going to be some really significant information that was redacted, but it turned out to be just a stupid officer in the department deciding that because it was about my brother, I couldn't read it. Mm. So we got lots and lots of that. But we've also got lots and lots of examples where the content is grossly inaccurate or inadequate or even misused. My Joyce Sinnott was placed in the Ballarat orphanage in 1926. She happened to be my mother's sister. She was age 5 when she was put in there by her grandmother during a period of crisis in the family. And 3 years later, another girl named Minnie Green was placed in that same orphanage because her foster parents, who had had her from infancy, could no longer support her. We're just on the cusp of the Great Depression, and people were unemployed and, you know, scrabbling to make a living. Now, the orphanage didn't know that Minnie Green and Joyce Sinnott were sisters because their intake procedures and documentations were deficient. And Minnie and Joyce had no idea they were sisters either. They both had been separated as infants when they first were separated from their parents. And so they had different surnames and they came in different ways. Eventually, Minnie was actually rescued from the orphanage by her foster parents who got back on their feet after the Depression eased off. She was angry and you can imagine quite rebellious. She was returned to her mother, and her mother found her really hard to handle. So she asked the police for help. And the police then found that she was pregnant. She was charged with being a neglected child lapsing into immorality. That phrase crops up time and time again in the documents. The police prosecution told the magistrate, when she was charged with this dreadful crime of being neglected, they told the court she'd been an inmate at the Ballarat orphanage, as if that was part of her neglect. So they actually used the record of her being in the orphanage as part of the prosecution of her being neglected. They told the magistrate that she wasn't going to Sunday school. They mentioned VD, but they didn't provide any actual evidence that she had VD. They mentioned that her mother was on sustenance, as if that was a crime. That was part of her, cluster of things that she'd done wrong to warrant the status of being a neglected child. So she was made a ward of the state, despite the fact she was nearly 17. She had been at work since she was 14. She was sent to a Catholic girls' reformatory in Oakley. Some of you will know it. And when her daughter was born, she was taken away from her and made a ward of the state. So they actually got two for the price of one, Minnie at 17 and the daughter. They didn't see each other ever again, which is sad. So going back to the Joyce, she languished, the other sister languished in the orphanage until tragically in 1933, she died of a neglected wound. She had a wound in her leg and it wasn't attended to. The undertaker who buried her was the orphanage superintendent's father. There was no inquest. The death certificate listed her grandmother as her mother, despite the fact that the entry register mentioned her mother's correct name. It's just incredible the amount of carelessness or even gross negligence, if you want to put it more strongly, that these authorities showed towards making records.
Yes.
The records, the archives that survive are as chaotic as the lives that these poor children and families lived, and they're absolutely not a reliable source for historians. And there's this paradox, like they're incredibly important for care leavers to find their institutional records, and that's often the first step that they have to go through. But the perspective that you get from these records, apart from just gross inaccuracies, and another story I heard recently from a family in Geelong when one of several siblings in a Catholic home died while in the home. They put the name of another sister on her headstone. Like just such a stunning lack of care that leads to errors like that. And yeah, you're forced to rely on these records, but if you're going to make any sort of family story for yourself, you have to learn to look for information in other places like Frank has, and to read these files in a different way that doesn't adopt that same worldview of the institutions, because that the lens that they saw these children and families through is just fundamentally judgmental and derogatory, and who wants to base their family stories on that perspective?
Yeah, I realised with Frank telling the story about the undertaker being, the working for the orphanage in other capacities, and often you had a small community of welfare, or what we would call it welfare now, but a small community of people engaged in this area of work, who were all the same people that were reporting to the police and to the press, and all these essentially judging particular families and particular children in particular kinds of ways, and essentially, dooming them like they're right from the start, and then it gets very, very difficult. And if you're in small towns, you know, I studied the records in Hobart, where it was you really clearly see the multi-generational thing if you look at a body of files running down, and this kind of you know, statements, this is a very bad family, this is a you know, this child's sister was doing this, you know, those kinds of judgments run through. But is there a way that that we can talk back to those records and change those kinds of perspectives, like in our own mind, but also at a more kind of formal level? Is there, you know, what can we do to handle the kinds of information that we find in these things?
I'll just say something quickly, Frank, and then over to you again. One thing you didn't mention about all the many things that CLAN does is the Australian Orphanage Museum, Frank. And we're working on a project with them at the moment that we're calling Talking Back to the Records, and we're talking to people who grew up in institutions in Geelong about the way that they feel about their records, and just sort of engaging with that idea of talking back. Right of reply to records is an emerging issue in archives, particularly when it comes to Indigenous archives and Indigenous knowledges, and how, I mean, Naomi, you said earlier, these records, they don't belong to the people whose lives are in them, but archives are trying to change that too, and to say, actually, you know, no matter who has custody of them, and no matter what the law says, there are moral rights of ownership, and the people in these records have their stakeholders. And how do we change the systems to actually acknowledge those rights that people have? So, yeah, talking back, that it is actually allowed under FOI and privacy legislation. It does give people a right to correct incorrect information on your file, or to annotate them, to add your side of the story. Funnily enough, most organisations and government departments don't tell people that proactively. But you know, so that is an option that's available when there are, you know, gross inaccuracies on your file, or you want to get your story across. But I think increasingly care leavers are starting to talk back to the records in other places, like they're moving out of these systems of official archives and just starting to tell their own stories in new places, and in spaces that are, you know, owned and controlled by them, and they're just leaving the archive to tell its own story, which is always going to be hugely flawed. So yeah, Frank, do you want to talk a bit about, we were chatting earlier in the week about reading against the grain, and how you can find these glimmers of voices within the records.
Yeah, I mean, you're absolutely right. The records are so flawed that some people would say, well, won't learn anything there. But I think in fact, they represent a good opportunity to learn a lot. I mean, I learned a lot about the system by closely examining my fairly voluminous records and swapping notes with my brothers. The first thing I'd want to say about that is that you can interpret the silence in the records. The children's voices are never included, and only rarely do parents' letters get included, but children's voices are never there. Children were never asked for their opinion about anything. And I think that tells us a lot about the institutions and the way they ran and what they were there for. In my PhD thesis, I actually offered a sort of conclusion that the silence in records is the sound of powerlessness meeting unrestrained authority. And I went into some of the ways in which that unrestrained authority silenced the voices of children. But you can read against the grain, and when you can't get collective defiance or rebellion is not possible, it's still possible to actually cease the sullen silence of many children in their behaviour as a kind of agency. Deleth Edwards has written a book about institutions in the UK, talks about individual and collective micro practices of resistance. It's a lovely phrase. For example, she points out, and I can see the merit of it, that punishment books can be read more than one way. You can read it as bad behavior or refusal to conform with repressive rules, or you can actually read it as an active response. There are a few very few studies that have looked at the way children created their own unwritten rules and organized themselves in institutions. I think that's an area that could be looked at. Children systematically stole food. They carved graffiti. They created body carvings, even tattoos. And most importantly, I think more important than any of those others, is they absconded in great numbers.
Yeah.
Now, if that's not exercising agency, I don't know what it is.
Yeah. Leonie, who's in the audience, hello Leonie, did some fantastic work on absconding by going through the police gazettes in different states where they're available. In Victoria, you can just walk up to the shelf and look at the police gazettes, and they have reports on all the children who absconded, and sometimes have like descriptions of them, physical descriptions, which, you know, is such an amazing thing if you're trying to find out what your ancestors were like. And Leonie did a systematic analysis of these absconding and used it in a submission to the Victorian inquiry into abuse in church and charitable institutions. You know, on the one hand, you could look at absconding as, you know, look at the trouble that these kids caused the police and the institutions, or you can look at it another way, which is to say, you know, what were they running away from? Why did no one ever ask? And Leonie was able to match, you know, high numbers of abscondings from the homes that were notorious for abuse and were found to have been sites of, you know, tremendous amounts of sexual and physical abuse against children.
Yeah, and that's important. I mean, the sort of insights that Leonie and others would bring to that information found in the Police Gazette, I think is rare. It's an insight about knowing that there are particular institutions which are really, really bad, and they come up in many other ways. Also, I mean, insider knowledge. I remember on one occasion we looked at a Police Gazette, and it didn't say people absconded from a particular orphanage. It said they absconded from 200 Victoria Street. Well, only a care leaver would know 200 Victoria Street, Ballarat, was the Ballarat orphanage. So care leavers can bring that kind of background knowledge that other people don't have to make sense of the police records. I love Leonie's approach to giving their records to care leavers who absconded, and where absconded is mentioned. You're my hero, she says. I never had the guts to run away. And that's another way in which you put a different light on the whole issue of absconding from terrible institutions.
Yeah, and changing that story and changing people's inner story as well, like narrative practice that I've read a bit about, is about trying to, create yourself a new story and get out of these problem-saturated problem stories that people might have about themselves.
Yeah.
And so that exchange that people have when they're accessing their records. I just wanted to mention, a lot of the time care leaders are doing a lot of this research themselves, but a lot of the time they are getting this information through an intermediary of an organisation like CLAM or another support service, who they help people to interpret these records, and that role as an intermediary can be really powerful in how people interpret the information on these records, and you don't want to take it at face value, and it can be really valuable to look at it in ways that, you know, show that the child was strong, or that their parents were trying to get them back, and tell a different story to the ones that institutions tell, and their records are just basically trying to justify to the system that they were working in that what they were doing was the right thing. So of course they're going to say that they're doing the best thing and that this is a bad child or a bad family.
Mm.
Yeah, absolutely. Yeah, we might move to questions, I think, because we've got quite a few coming up, and there's a couple of people have asked specific questions about access to people who have been to people, to records of relatives. But this is a kind of a question from Jim Goddard, who I believe is in the UK, who has a question for Frank and anyone else who knows about this. And this question covers that sort of broader sort of access thing. And he says that in the UK, our data protection legislation allows files to be accessed, but the law only allows access to one's own information. And that means that information about other people, including family members, can be redacted. Mm-hmm. So censored effectively. And I think you did touch on this, Frank. So this applies even if those other people are dead. And it means that for some care leavers, huge chunks of their files are blanked out. This can be frustrating for many care leavers. How much of an issue is that for Australian care leavers?
Well, it is an issue, but it's less of an issue than it was when I first got involved in this in the mid-1990s. I think we've come a long way in Australia, at least recognising the moral rights, as Kate, I think, mentioned before, the moral right to access to records. It doesn't have to be through FOI legislation or privacy legislation. It doesn't have to be through legislation at all. There is the possibility, and more and more agencies are exercising that option of saying we can actually give the records, or give access to the records to people just informally. You don't need to make a formal application. What harm is going to be caused by somebody having access to information? There are very, very few, in fact, I know of none, no legal actions taken against any agency that's provided information about a third party being a family member or someone close to the subject of the records. The fear is all in the minds, I think, of bureaucrats who've got this risk-averse mentality. The Commonwealth Government in Australia actually sponsored a project looking at the principles and practices or best practice in record access. And most states have actually accepted that or something close to that as a set of guidelines. And you don't run into these problems much these days, although redactions are still happening here and there. It sometimes depends on the individual who's in the bureaucracy who's dealing with that particular application. But by and large, the sense is that most people take a more sympathetic or empathetic approach to releasing records.
Yeah, then that document, the best practice guidelines for releasing records, which you can find on the DSS website, is an amazing document. And it doesn't have any, legislative weight, but and it's an aspirational document, but I think it is, really starting to make a change in the culture of many organisations and people who work for them. And it just starts from, I think one of the first principles is just access to information should be a default, rather than putting up that barrier to access as a default, which is the way that the, acts like the Privacy Acts and FOI are designed. And there's a long way to go, though.
Yeah, speaking directly to Jim Goddard in the UK. Hello, Jim. CLAN, of course, has not waited for bureaucrats and policy officers and so on to act in this area. We've established a Charter of Rights, and we're working with Monash University to make that Charter of Rights more universally applicable to children in care today too. And we've just asserted that we have rights, that brings a bit of moral pressure on the agencies to look at their practices. For example, when we say we have the right to know who's accessing our file, okay, how can you argue against that? It's an invasion of privacy, isn't it? if someone is reading my file and I don't know about it? Who are they? What do they want? Why are they doing it? So, you know, that's just a simple example of one of the rights that we assert exists.
Absolutely. Yeah, I think it is. And I mean, at the moment I've been following the Ashley Detention Centre case in Tasmania, where there are the same problems that were happening when the institution was first founded 100 years ago. They're again today, and it's the thing of the privacy of the staff is respected, but not necessarily the privacy of the children, and it has to come out in a public inquiry before people kind of take notice of it. And I think I have a question from Kath at Penanky Travis, who spoke so well at our very first webinar about her own process of re-authoring the archive, and she asked if you have any ideas about how we might address the silence of children's voices in care right at the moment. And I think you've already hinted that that's where you are going, but would you like to say any more about that?
I'm sorry, Naomi, I didn't quite
I was
understand.
rambling a little bit.
Yeah.
So essentially, Cass' question is whether what ideas you have about addressing that silence in that space for kids that are still in out-of-home care.
Kids still in out of home care. Well, you know, we had that report in 2015 from the Children's Commissioner, which said that children are still being frozen out of the process. But you know, I think there are agencies around Australia which are seeing the benefit of engaging the children in care. I mean, and also in the training of care workers, social workers. They should now be getting the message, and I think in a few places I've heard they are, that they're actually writing records which historians will use into the future, and children will use into the future, and they're much more conscious and aware that what they write now might actually tell a future historian or a future care leaver more about them as writers, as people, than about the subject that they're writing about. So I think there's more consciousness now of getting children involved, but there's still too much, I think, of adults writing records for other adults rather than writing records that might be useful for children into the future.
Yeah, I mean, there are, if best practice is being followed in out-of-home care and child protection today, children shouldn't have any surprise at all when they apply for their files as adults, because they would have been there alongside the people creating the records. They would have been consulted about what they thought. They would have been invited to put their own perspectives there. But as we know, that doesn't always happen. And particularly with Indigenous children in care in Victoria, I remember that report that was published, 7 years ago now, they recommended that a genogram be created for every child as soon as they come into care, and particularly for Indigenous children, so that they can start to map their relationships to their immediate family and extended family, and so the whole time that the child is in the out-of-home care system, that those links to their culture and their community are recorded, and they're reinforced, and the child's encouraged to know who they are. But yeah, there's a long way to go.
Yeah. I just want to touch on a couple of very quick sort of family history based questions that have come up in the chat. And one is about the length of time you need to wait after a family member was in state care. And yes, usually, unless you can make some kind of extraordinary case for it, you will have to wait for those records to be made public.
99 years for children, records relating to children from the date the record was created.
Yeah, and it's the same with mental health and other forms of institutionalization. In fact, hospital records, court records, all of those kinds of things are at that maximum level. There was a question which I might just sort of answer because I know the answer to this, but it was from Nikki, which was it ever possible to pay for your children to go into care? And were they always made wards of the state? And the answer to that is that often parents who were had fallen on hard times would voluntarily take their child to an institution intending to pay for the child's care, and then if their situation worsened or they were sick or whatever may happen, they sometimes stopped payment, and sometimes when they really couldn't do it, other times, you know, the parents might have had mental health problems or whatever, and they would stop payment, and at that point the private agency that was taking the fee would generally alert the state authorities, and the child would be put into care. And often they did not know whether that they had been transferred to the wardship of the state, and they would come out of care and find out much later that they had been wards of the state. And that was simply a financial decision made by the agency that had the child, that they could get money from the government if the person was a ward of the state. And it causes a lot of shame and embarrassment to people to find that they were wards of the state, or to find on leaving that they were under much more control than they thought they had been. So yeah, good intentions sometimes of parents in desperate circumstances could really backfire. Yeah.
And different records are created for people depending on whether they were a ward of the state or not. And a lot of people who weren't actually wards of the state, but were there, you know, voluntarily or informally, they won't have that machinery of the government department take, you know, recording records about them, however flawed or scanty those records are. Some people who weren't wards of the state have, just such a very, very little documentary trace is left of their time, you know, sometimes almost 18 years in care. And sometimes some people can't find anything at all. Yeah.
The irony is the naughtier ones are going to be the ones that are noticed, aren't they? They're going to have the thicker files if they've been, you know, they've been more active in those respects. And I just suppose, I mean, what I'm seeing coming through the comments in the chat is that level of frustration at agencies that aren't helping people with accessibility, and that varies across the country as well. As Leonie points out, she thinks that Queensland is probably the worst, and that you know, social workers are much more concerned about their own interests than any other kind of thing. And there's sort of level of ongoing frustration and pain that we as historians can see has been built into the system since time, you know, well, when it began to be laid down in the 1870s and 1880s, and very little has actually changed in lots of respects. And it's very frustrating to watch government policy continue playing out in this. And I think it's, the funding has improved, would you say, Kate, for indexing and those sorts of things that help people find themselves in the records, but it's an expensive and difficult process, and it's not often a priority for governments.
Yeah, for sure. And I mean, governments have been forced to put a lot more money into indexing and looking after their own collections. But it really did take the Royal Commission and its powers to get a lot of government departments to start to pay attention to that. But and a lot of the churches and charities, their archiving practices improved a lot as a result of the Royal Commission. But there's really not a lot of funding available for it. At Find and Connect, we've run small grant schemes periodically where we give small grants to non-government organisations to improve their records management practices. But yeah, I mean, it's hard for it to be seen as a priority and as a core part of what they do when they're also just busy providing community services to people in need and reacting to crises.
Yeah, thank you. And then we're just right at the end, so I've had two people expressing their deep appreciation for Frank's generosity in turning something so difficult for himself into something that's so positive for such a wide array of people. And I would also extend that thank you to Leonie, who's quietly been sitting there typing out stories of what she's doing today. There's no stopping you, is there, Leonie? It just never cannot be stopped. So I want to thank both of you so much for tonight's presentation and for this like crucial information that that you know helps all of us, I think, as humans as well as historians and family historians. So thank you, Frank, and thank you, Kate. And that might be it. So thank you, everybody. It's been a great webinar.